Meantime, experts are cautioning the reason why we might be seeing an increase in cases is because the CDC is now broadening the guidelines when it comes to who can be tested for the virus.
As 8 News Now reporter Joe Moeller found, since the virus presents with flu-like symptoms, it is now up to a doctor to determine if a person should be tested.
All right, let me ask a couple questions.
Hospitals around the valley are stepping up their screening efforts.
Any cough, fever, shortness of breath now in the last week?
Sunrise Hospital is screening every person walking through the doors.
The level of screening that we're doing is a little higher. It's just like we did when H1N1 flu came out a few years ago.
This comes as the CDC steps up efforts to confirm who has the coronavirus. Wednesday, the CDC expanded their criteria on who can be tested.
In weeks prior to and even months prior to, it's been really kind of very specific to travel locations and very specific symptoms.
Southern Nevada Health District Disease Surveillance Supervisor Kimberly Hurton says as more cases pop up, the CDC wants to confirm them as soon as possible.
We rule out those typical infections that we see, and then from there we can coordinate a sample collection and possible testing if they do kind of meet the need for that test.
Sunrise Hospital is ready to test if needed.
If you meet the criteria, we'll contact the Southern Nevada Health District, who has the test available, and we'll work with them to obtain the test and the results.
From the testing to the screening, those visiting the hospital say the extra efforts are appreciated.
A relief that somebody's doing something about the situation that we face.
Reporting in Las Vegas, Joe Moeller, 8 News Now.
Leaders at the State Health Lab at UNR told us that so far at that location they've tested 6 people for the virus. Officials here in Las Vegas say the local lab has conducted tests since getting the testing kits last Thursday, but they did not reveal how many.